Well, good morning. It's a beautiful sunny morning. I've moved outside into my backyard. Welcome. The subject for this particular video is it's just going to be a full COVID-19 breath technique, and it's a combination of what I've learned from doctors and what I've learned from my own yoga therapy practice works for me. Um, and I'll get into that in a bit more detail. I had some requests for a full practice, and so this is to honor that request so that you don't have to think. You can just do it with me. And somewhere on this screen in a moment, there'll be a spot to fast forward to that spot. Um, but before I get to that, I'd love to ask you to please subscribe to this YouTube channel. It will help me in the long run, and it's a simple one button press that you can do to help me out, and I would greatly appreciate your support in that way. And even if you don't, thank you for watching this video, and I hope you find it helpful to you. So. Just a little bit of information first before we get started with the practice. And this is where you can fast forward past this, but I do recommend that you listen to all of this for the first time so that you can understand why some of the things are being done as they're being done. And then I'm going to go through a description of what we're doing. So the one thing that I have found rather terrifying, as somebody who has suffered from asthma and has had pneumonia more times than I can count in my life, including when I was 7 months pregnant, um, which is terrifying in and of itself because you got baby pushing up, you got fluid pushing down, and I ended up in the hospital. So I know what it is to be in the hospital with pneumonia. And so I know what pneumonia feels like in my body. I also know what it feels like when it's getting ready to start. And to hear reports now that they're doing x-rays and finding pneumonia in people where none of the symptoms appeared, that's for somebody like me who is somewhat susceptible to that, is terrifying. So I want to do everything that I can to assist my body in functioning, my lungs in functioning at their top capacity, because they're already somewhat damaged because of my life and because of my asthma. Um, so I have been doing the doctor recommended breathing at least once a day. Um, but if you looked in the other video, as I did afterwards, and looked at my face, what you'll see is that it's anxiety inducing. It's terrifying. Yes, it needs to be done. And I think it happens because you're holding your breath in this. And we'll talk about more the logistics of how you do this in a moment. But you have to hold your breath for part of it. And I think our brain still, the part of our brain that is still ancient, goes back to drowning when we're holding our breath, or that's life threatening to hold our breath. And so, therefore, with every part of our being, we feel this need to survive, and it makes us anxious. It takes us into the sympathetic nervous system. It takes us into that fight or flight. So um, my suggestion, or the thing that I started doing and that I found helpful, is to add on a second section. So this is a 3-section breathing technique. um, the first section is the doctor recommended stuff, and then there's a anxiety recovery yoga therapy section in the middle, and then we'll go to the prone breathing. So the other thing that I'd like to point out is that our lungs are three-dimensional. Everything we do in our lives is in front of us. If something is behind us and we need to work on it, we turn our whole bodies around. So everything we do is in front of us. We're very unaware of our backs. Women, when they do their hair, it's really hard to see the back, or to make sure that the back looks right, because you can't see it unless you got mirrors all over the place. So I think that sometimes we tend to think that our lungs exist on the front of our body and that our ribs exist on the front of our body, but no, the ribs are three-dimensional. They go all the way around to the back. The lungs are three-dimensional. They breathe not just on the front, but the back. In fact, we have, there's a butterfly flying around here, we have more lung space on our backs than we do in our front, because in our front, on the left side, our heart has to kind of nestle in there. So our left lung has one less lobe than our right lung. Our right lung has to nestle up because it needs to make room for the liver, which is below it. But it still has three lobes. So most of its space is on our back. So just as an experiment, take your hands to your side ribs and take a deep breath and just feel how it's expanding, not just on the front, but on your back. And because there's a little less invasiveness from the heart, we tend to have more lung tissue on our back. That is why they're finding, I believe, that if they lay people prone, they're getting better results in the hospital. So let me just go through now the sections of this a little bit more for you. And just so that you know, I have a yoga mat outside to lay on, and I also have a yoga block with me. Those are the only two things you'll need. If not a yoga block, this is for our forehead. We're going to put it here to give ourselves a breathing gap here so that we can be completely prone. So imagine that this is the floor. So maybe like a firm pillow that you can put on your forehead just to give yourself a little hole here to be able to breathe. That way you don't have to turn your head one way or the other way when you're laying down. So a block or something firm like this, maybe a book. You can also use your hands on your forehead, interlace your fingers or stack them, whatever works for you. Sometimes I start with this and then my low back starts hurting and I'll move to my hands, and I probably will do that today. So I like being outside because sun is good for us. It gives us vitamin D. Some theories say that the sun is killing this virus as well. So doing this first thing in the morning is great. The other thing that I noticed, and I'm hoping this happens today, is that when I get into this with the sun and I start breathing through my nose, when I get to that section, I start sneezing and I get some stuff up. So things become more productive. And I think it's the combination of all these elements of being outside in the sun and doing this exercise from the doctors, adding the yoga therapeutic part to it. I think it all works together to create a perfect storm of getting up congestion. So let me just talk a little bit about the actual procedure here. The doctors want you to breathe in through your mouth, hold for 5, and then exhale completely. Do that 5 times. On the 6th one, instead of holding, you cough. Then you repeat that. So it's 12 breaths altogether to get through that section. And that's where I start to feel like I'm just feeling anxious at that point. So what I have done is I'm repeating it, but I'm breathing completely through my nose. Breathing through your nose is calming to the body. You get more nitric oxide. 25% of our nitric oxide is produced in our sinuses. And nitric oxide helps us to feel calm. It helps all of our vessels to dilate, to become bigger so that more blood can flow through. Our tissues get more nourishment through the blood and the oxygen that's getting to them. So, just it's an overall good thing to do for your body. It takes you out of that fight or flight and into rest and digest. So do what the doctors say and then calm yourself down in the second section by doing the whole thing again, the 5 breaths in, holding, exhaling, and then coughing on the 6th one on the exhale. But breathe through your nose for those. And I'll probably briefly stop. This is not really meditative, this practice. It's a practice to help keep you healthy. So don't think meditation when we get into this. Think pranayama or breath work. And then the third section is to lay down prone, and just to do the same kind of breathing, but without the cough and without the holds and all that. Just continue with that deep breathing for 10 minutes. And so I have borrowed my husband's phone, and I've downloaded an app called Insight Timer on it. I'll try to remember to put that in the link. And I have set it up to do a 10-minute time where every minute, on the minute, it will ding so that you'll know one more minute is passed. And then we'll come back together at the end of that time. I just want to double check to make sure that, yep. We'll come back at the end of all of this just to close this out. So let's begin and see if I get the same reaction I got the other day in my body. So first section, doctor section, inhaling through the mouth, holding for 5, exhaling on the 6th one, coughing, repeating it twice. So let's start. 6th one. Again. Getting dizzy. And cough. Repeating that, breathing through the nose. And the cough. Second time through the nose. And the cough. And we're going to move to lying down on this mat. Let me see if I can change the angle a bit. Block. So I'm going to lay down. And start the timer. And just remember to breathe. Breathe like you were breathing just now. Continue with that, but without the holds. and just bring yourself up however that works for you. Those aren't recorded birds. Those are my actual birds out here. It's just wonderful to listen to that. I hope you enjoyed this, and be well. Namaste.